Misleading marketing and detox trends often oversimplify liver health. Fatty liver is not typically improved through quick fixes, but through understanding underlying metabolic processes. From a clinical perspective, the focus is on evidence-based strategies grounded in current research. In this video, we'll examine what current data actually supports, including safety considerations and findings from human studies to help guide more informed decisions. In the context of fatty liver disease, it is essential to establish a clear hierarchy where nutrition comes first. No supplement can compensate for a consistently poor diet or a sedentary lifestyle. In clinical practice, supplements are not intended to replace a balanced nutritional foundation, but rather to support physiological processes that are already underway within the body over time. Their role is best understood as complementary rather than corrective. Certain bioactive compounds have been studied for their potential to influence key metabolic pathways, including insulin sensitivity, lipid metabolism, and low-grade inflammation. For example, curcumin and omega-3 fatty acids have shown potential benefits in human studies, though the magnitude of these effects is often modest and dependent on the overall dietary context and individual variability. Used alongside a diet centered on whole, nutrient-dense foods, supplementation may provide additional support. This integrated approach helps ensure that any benefits are meaningful, safe, and aligned with long-term metabolic health, rather than relying on isolated or short-term interventions. Once this nutritional foundation is established, the next priority is safety when introducing any bioactive compound into your routine. In metabolic health, the line between therapeutic benefit and potential harm often depends on dosage, formulation, and individual context. Compounds commonly perceived as natural are not inherently risk-free, particularly when used at higher doses or without appropriate guidance. For instance, excessive intake of omega-3 fatty acids has been explored in some studies with an increased risk of atrial fibrillation. Similarly, vitamin E, while studied for its role in advanced liver fibrosis, has been linked at certain doses to higher rates of all-cause mortality in prostate cancer in specific populations. These findings highlight the importance of careful evaluation rather than assuming safety based on marketing claims. Because supplements may interact with medications or underlying conditions, professional oversight is essential. A qualified healthcare provider can help tailor an approach aligned with your medical history, ensuring that supplementation supports your health without introducing avoidable risks. After establishing safety considerations, attention can shift toward compounds that target the metabolic drivers of fatty liver, beginning with curcumin, the primary active component of turmeric. Curcumin may help enhance glucose uptake by influencing GLUT4 transporters in muscle and adipose tissue, which may help reduce circulating glucose levels and improve insulin sensitivity. Beyond glucose regulation, curcumin appears to interact with the AMPK pathway, a key metabolic regulator also targeted by medications such as metformin. It has additionally been investigated for its potential effects on pancreatic signaling related to insulin secretion. Although these mechanisms continue to be explored, clinical evidence suggests these effects may be present. A 2019 meta-analysis of randomized controlled trials reported that curcumin supplementation was associated with reductions in liver enzymes such as ALT and AST, along with improvements in certain metabolic markers. While results may vary across individuals, these findings suggest a potential role for curcumin as part of a broader, evidence-based approach to metabolic health. The gut microbiome plays an increasingly recognized role in liver health, particularly through the gut-liver axis. Studies indicate that individuals with biopsy-proven fatty liver disease often exhibit increased intestinal permeability, commonly described as a leaky gut. This disruption may allow bacterial components and endotoxins to pass from the gut into the circulation and reach the liver, where they can trigger inflammatory responses and metabolic stress. Over time, these processes are believed to contribute to disease progression, potentially advancing from simple fat accumulation to more severe conditions such as non-alcoholic steatohepatitis. Although the underlying mechanisms remain complex and continue to be investigated, maintaining intestinal barrier integrity appears to be an important factor in metabolic regulation and liver protection. Probiotic supplementation has been explored as one supportive strategy in this context. A 2022 Umbrella review reported associations between probiotic use and improvements in liver enzymes, including ALT, AST, and GGT, suggesting potential benefits for overall metabolic stability and gut health. Maximizing the benefits of probiotics often involves a combined strategy known as synbiotics, which pairs beneficial bacteria with prebiotics. Prebiotics are non-digestible fibers that serve as a primary energy source for the gut microbiome, helping support bacterial survival and activity within the intestinal environment. Without sufficient intake of these fibers, beneficial microbes may struggle to establish and maintain their presence over time. Clinical research has begun to explore this combined approach. One trial reported that symbiotic supplementation over several months was associated with reductions in hepatic steatosis grade, along with improvements in markers such as body weight and waist circumference. While findings may vary, these results suggest a potential role for dietary strategies that support both microbial balance and metabolic health. Importantly, prebiotics can be obtained from commonly available whole foods, including oats, legumes, fruits, and certain vegetables. Incorporating these fiber-rich foods into daily meals may help create a more supportive environment for the gut microbiome, contributing to overall metabolic stability and liver health. Alongside strategies that support the gut environment, attention is also turned to plant-derived compounds such as berberine. This naturally occurring alkaloid has a long history of use in traditional medicine and is increasingly being studied for its potential metabolic effects. Current research suggests that berberine may influence multiple pathways relevant to metabolic health. Experimental studies indicate that berberine can interact with the gut microbiome, with potential downstream effects on hormones such as GLP-1, which are also targeted by certain modern therapies for diabetes and obesity. Although much of this evidence remains preliminary, it provides a basis for further investigation. Human studies further suggest similar trends. A meta-analysis of randomized trials has reported associations between berberine supplementation and improvements in liver enzymes, blood glucose, and lipid profiles. These findings suggest that berberine may influence several components of metabolic dysfunction simultaneously. When considered within a broader lifestyle approach, it may serve as a complementary strategy to support metabolic balance and liver health. Beyond herbal approaches such as berberine, certain nutrients play a fundamental role in lipid metabolism, particularly choline. This nutrient is essential for liver function because it supports the synthesis of phospholipids required to transport fat out of liver cells efficiently. Without adequate choline, fat may accumulate within the liver, contributing to metabolic dysfunction and progressive fat deposition over time. Observational research has highlighted this association. A case control study reported that higher intake of choline and betaine was linked to a lower prevalence of hepatic steatosis, suggesting a potential protective relationship in certain populations. However, these findings do not establish causation, and further research is needed to determine whether high-dose supplementation provides additional benefit, particularly in individuals without deficiency or significant metabolic impairment. From a clinical perspective, prioritizing dietary sources remains a prudent approach. Foods such as eggs, lean meats, dairy products, and seafood provide bioavailable choline within a balanced nutritional context, supporting safe and sustainable long-term liver health. Another important component in managing liver health involves omega-3 fatty acids, particularly EPA and DHA. These compounds have been studied for their ability to reduce inflammation by modulating pro-inflammatory cytokines and to enhance fatty acid oxidation, which may help limit liver fat accumulation over time. Their effects make them a relevant consideration within a broader metabolic strategy. However, an evidence-based approach requires careful attention to dosage and individual risk factors. Higher intake levels have been associated with greater improvements in certain liver markers, but some studies also suggest a small increase in the risk of atrial fibrillation, a cardiac rhythm disturbance that may carry clinical implications in susceptible individuals. In practice, high-dose supplementation is typically reserved for those with elevated cardiovascular risk, where potential benefits may outweigh known concerns. For most individuals, obtaining omega-3 fatty acids through whole food sources such as fatty fish, walnuts, and seeds represents a more balanced and sustainable approach. Consulting a healthcare professional can help guide appropriate intake. Coenzyme Q10, commonly referred to as CoQ10, represents another compound of interest due to its potential antioxidant and anti-inflammatory properties. Chronic inflammation is a key contributor to the progression of fatty liver disease, and CoQ10 may help modulate these processes at the cellular level. Its involvement in mitochondrial energy production may also support overall metabolic efficiency, cellular resilience, and improved energy utilization. Clinical evidence provides some support for these effects. In a double-blind, randomized controlled trial, CoQ10 supplementation was associated with reductions in liver enzymes such as ALT and GGT, along with decreases in systemic inflammatory markers including CRP and TNF-alpha. While these findings are encouraging, they are based on relatively small sample sizes and should be interpreted with appropriate caution. Safety remains an important consideration. CoQ10 may interact with anticoagulant medications, potentially affecting their efficacy. For this reason, consultation with a healthcare professional is essential before use, particularly for individuals managing cardiovascular or metabolic conditions. Vitamin E represents a more intensive intervention within this framework, particularly in the context of advanced liver disease. As a potent antioxidant, it has been studied for its ability to reduce oxidative stress, a key factor in the progression of non-alcoholic steatohepatitis. Clinical trials have reported that supplementation at doses around 800 IU per day was associated with improvements in liver histology, including reductions in steatosis and fibrosis in selected patient populations. Despite these potential benefits, safety considerations remain critical. Higher dose vitamin E has been linked in some studies to an increased risk of all-cause mortality and a higher incidence of prostate cancer in specific groups. These findings underscore the importance of careful patient selection and clinical oversight. For this reason, vitamin E is generally reserved for individuals with more advanced disease and should be used under medical supervision. While targeted supplementation may offer additional support, long-term improvement still depends on sustainable lifestyle changes rooted in evidence-based nutrition and metabolic care. Thank you for watching. This content is for educational purposes only. If this changed how you think about nutrition, don't forget to like and subscribe for more science-based insights.